Min. I'm pharmacist here in hospital.
So the first question is, where do you work, the hospital, and how long have you been a pharmacist?
I have been working as a pharmacist for 7 years, and
Okay.
I work as a clinical pharmacist most often. It's just like taking care of the medical floor. Sometimes cover ICU, sometimes for the pediatric units for
Uh,
pharmacy questions.
what does your job consist of? What are your duties?
My duties. Those medications to check out drug-related problems and dispense medications, make sure the medication is safe.
What is your favorite part and least favorite part about your job?
Favorite part? Oh, I most my I like my job, all the part of it. The least part maybe there's too many to do but not enough time.
Okay. What school did you go to? What was the cost of tuition, and how was it?
I went to University of Saskatchewan. The cost I couldn't remember. It's around 9,000 per semester. Maybe a little bit less than that.
Um, what are the advantages and disadvantages to your job?
Advantages?
Advantages and disadvantages. What are the good things and the bad things about your job?
The good things that you can always refresh yourself. They always have new medication coming out, new treatment to coming out. So you can refresh yourself. You don't get bored. Disadvantages is that too many to learn. You can never be enough, and you have to keep up to date for the recommendation to the doctors.
Okay. How do you make medicine?
Make medicine.
Yeah. How do you make it? How do you put it in the pill bottles?
Oh, in the retail pharmacy, then they count in the pills and put into the bottles. And in the hospitals, there's two kind medication. Oh, more than two kinds. There's intravenous medications that we put into the bag, like saline bags or dextro bags, and run the medication intravenously. And there's oral medications that the technician count the medications out, and we do the final check, and we check the dose before they actually counting the medication out. And then in the hospital, it's unit dose. It's per patient, the medication is sending to individual patients.
Okay. So, could you work anywhere else outside of Ontario if you wanted?
Oh, yes, but I have to get the license. I need to take the jurisprudence exams and to get a license to work in other province.
Are there different rules for every province?
Yes.
Okay. Are there many responsibilities? If so, what?
What responsibility?
Like responsibilities in your job? Do you have to do something specific every time?
The responsibility, we just make sure that we check the right dose for the patients and don't make mistakes. Make sure the medications being sent out as doctors prescribed it.
Okay. What are your hours of work?
7.5 hours per day,
Uh,
and full time is like 5 days per week.
do you have shifts?
Yes.
Do you need specific tools? Do you buy your own
What do you mean?
equipment? Like
Equipment? or the calculator.
So only
Right.
calculator.
Hospital.
Hospital, yes. We don't have to buy anything except for the
Knowledge.
the calculator. We want one because we need to calculate the medication doses.
Do you need a special type of calculator or just a calculator?
Like the
Okay.
the
Scientific?
scientific calculator, because we need to calculate the vancomycin dose, and that that's special formula that you have to like use that kind of calculator.
Can you receive any promotions?
No, what promotions? No.
Okay.
Oh, no, promotion in the at work?
Yeah.
Yes.
Like, are there any specific ones for pharmacy?
Director. Director for me.
Yeah.
And the last question, name a few of your successes and tragedies that happened in your job.
Then a few of successful
Moments and tragedies in your job.
successful moments that it is that when you make a recommendation and doctor accept it and you see the effects of when you made the right choice. And the tragedy is I don't know. It's
Will argue with the doctor.
sometimes you think a recommendation is reasonable, but not really will get accepted by the doctor. But I wouldn't take it as tragedy dose because like there are different reasons to not use. Like different people have different thought about a condition.
Okay. Would you recommend for people to take pharmacy as a job?
Yeah. Because like I think it's important to look at patients' medications and look at whether they use the right regimen to treat their disease conditions. There's a lot to do, and you can do patient educations on a lot of things like smoking cessation. You can do the anticoagulations, and you can calculate the doses, and you can watch for the side effects and do follow up for the patients. I think it's great.
Okay, thank you.
You're welcome.
She's a doctor.